Okay. Hello and welcome to the first live interaction of the NPTEL MOOCs course on Economics of Health and Education. This is the second run of this course on the MOOCs platform, and I welcome all the learners to this interaction meeting. I hope you can ask your doubts or questions pertaining to the course, and we will see how best we can tackle some of these questions. Now, having said that, let me also give you a brief introduction to how this course has been designed and what is the intention of this course. This course is offered at a very basic level for students across different disciplines, and we are not assuming any prior background in economics. The aim is to introduce the core economic ideas through the lens of health and education, showing how these sectors are central to human development, human capital, and public policy. I am expecting that the learners of this course will learn how economists conceptualize health and education as both rights and investments, why the markets for health and education are different from typical goods and services that are available in the market, how market failures like externalities, information asymmetry justify government intervention, the role of human capital in explaining demand for education and health. And we also have introduced some of the basic tools of economic analysis like demand and supply, utility function, insurance, public goods, and we have applied it to certain contexts. So my intention of offering this course is to combine theoretical frameworks, empirical evidence, and policy debates, keeping explanations accessible to students from engineering, sciences, humanities, and social sciences. As you know, that this is a 12-week course, and we are currently, I believe, in this completed 6 weeks of this course. So what I have tried to do in today's live interaction is to give you a summary snapshot of what we have done so far, and then the learners can take up questions from there as they feel like. So currently, I think we are ongoing with our 7th week. In this first interaction, I have prepared a summary slide till week 6. And from week 7 onwards, we can take in the next interaction. So week 1 focuses on health and education in the larger framework of human development. I discuss some of the issues around human capital and human right. Week 2, I introduce learners to the unique aspects of health goods or healthcare in the context of health economics. Because often when we want to understand the health sector or health system, or we want to understand the demand and supply of health care in the health market, there are certain ways in which economists understand the demand and supply of health care. And although health as a subject matter transcends across various disciplines, it is useful for students or learners from other disciplines to also appreciate some of the economics concepts that can help us to understand the functioning of the health sector more efficiently. So in week 2, I introduced the learners to some of the unique aspects of health economics. I discuss very basic facts about perfect competition and how the healthcare markets are different from the perfectly competitive markets, which is sort of the basic model that we take up in economics to understand how markets function. Then I introduce a very basic demand for health Grossman's model. In week 3, we go into the details of the demand for health, where we discuss the shape of the healthcare demand curve and some of the other important aspects of the Grossman model. We also look up socioeconomic disparities and how that impacts health outcomes, or how health as a good also impacts socioeconomic outcomes. In week 4, we discuss supply of health, demand for health insurance, and some very basic concepts surrounding insurance, particularly with respect to adverse selection and moral hazard. In week 5, we move on to demand for education. We discuss a basic model of human capital investment. We discussed the concepts of production of education and returns to education. Then in week 6, we discussed budgetary policy, public good, the distinction between public goods, private goods, and merit goods. And we have a general lecture on classifying whether higher education qualifies as a public good or a private good or a merit good. And in week 7, we go into inequalities of outcomes and opportunities, where I have drawn heavily from sense conceptualization of inequality. We discuss equity in healthcare and education inequities in developing countries in India. Now, if I have to summarize the week 1 for you, week 1 sort of lays the foundation to this course, where we are looking at health and education from a human development perspective. Now, in economics, health and education are considered as investments, all right, but they are also considered as human development in the sense that these, if you want to say investments in health and education or rights of health and education, leads to enlargement of people's choices. So health and education are not just ends in themselves, but they're also means of production. We discussed some of the important indicators of health and education, the key indicators that are used to construct the Human Development Index, like the life expectancy, representative of health conditions, and literacy, which is representative of education. And we sort of discussed as to why these two simple sounding indicators of life expectancy and literacy are very important indicators, in the sense that it helps us to understand what people can achieve out of these indicators. What are the achievements that can take place after having good health, which is measured by life expectancy at birth, and having good education as represented by foundational literacy, and so on and so forth. So we also discussed in this context that income is a means and not an end, and well-being depends upon how income is used. And this is where health or education can become means of development and not just income. In week 1, we also discussed about human capital and human right. We saw that there are various perspectives of looking at health and education, but there are two overwhelming perspectives that have sort of dominated the literature, and it helps us to understand this sector well. One is the human capital approach, and the other is the human right approach. Human capital approach looks at health and education merely as investments, because they move towards raising productivity of individuals. So if you are a skilled person because you have some amount of technical education or professional education, or if you are in good health, it sort of raises your productivity in the labor market. So that's a human capital approach. But there is also a human right approach, that if you cannot afford investments upon yourself, because of lack of incomes or because of your social conditions of living, then whether or not health and education should be made available to you. So here we are looking at health and education as universal entitlements in the context of Universal Declaration of Human Rights. And therefore, we also discuss, is it not then paramount upon the state or the government or third parties to ensure that people who lack incomes or who face different kinds of deprivations, whether or not health and education can reach them within the larger context of them as human rights. We in this week, we also sort of distinguished we looked at the differences between human and physical capital. And we saw that when we look at human capital, we are looking at labor embodied within human capital. And that is one of the distinguishing feature with physical capital, because physical capital is something very tangible, but human capital is intangible. And we looked at some of the unique characteristics that can distinguish human capital from physical capital. And also that sort of set the ground for the policy debate surrounding economic efficiency or the returns to health and education versus the universality or the equity aspect of health and education. In week 2, Excuse me. In week 2, we had a brief introduction to the basic ideas around markets and demand for health. So in the lesson 1 of this week, we looked at the unique aspects of health economics, where we saw that healthcare is different because of certain special characteristics. One is there is a lot of government intervention in the health market. There's a lot of uncertainty surrounding health as an outcome indicator or health as a good, because we do not know when we can fall sick. So it's a random event. It's an uncertainty, and because there is uncertainty surrounding the event of falling sick, there are also uncertainties surrounding what is the treatment choice that we choose to have, because it's all surrounded around this uncertain event of falling sick. We also saw that health market, unlike perfectly competitive markets, can give rise to a lot of asymmetric information, because the doctors who are sort of the sellers of healthcare and the patients who are demanding healthcare are on an uneven plane, because the doctors are more informed about the disease or the line of treatment that the patients need to have, and therefore we don't have equality of information in this market. That becomes that's a very important assumption in a perfectly competitive market. We also saw that health market can have a lot of externalities, both positive and negative. In lesson 2, we went deeper into these assumptions. In lesson 1, we outlined these assumptions. In lesson 2, we had more discussions about these assumptions. And we concluded that health markets essentially fail the assumptions of perfectly competitive market. And that sort of gave us the justification to argue that governments have a very important role to play in this market. And we underlined the key characteristics of the healthcare market as uncertainty, asymmetry of information, externalities, and government role. In lesson 3, we introduced the Grossman's model for demand for health, where we looked at health not just as a consumption good, which gives us utility, but also as an investment good, as it improves future productivity. So we looked at health as a durable stock of capital. And we also made a very basic distinction between health and healthcare, where we said that when we say demand for health, it is not equivalent to demand for healthcare. And we said that demand for healthcare is a derived demand. We also looked at the health production and utility functions and formalized the trade-offs between them. Week 3, we went into some details of demand for health, where we extended the Grossman model and we looked at health as a capital good with depreciation. We also saw that exactly as other goods and services in the market, demand curve for healthcare is also downward sloping, which means it is price sensitive. And we showed it with the help of the US experiments on health insurance, the RAND health insurance experiment and the Oregon Medicaid experiment. And we saw that these experiments showed the relationship between price and insurance affect utilization of healthcare. Then in lesson 2, it was a little technical for non-economic students, but here we basically tried to say that consumers are not just spending on health goods, but they are spending on all other goods as well. And there is often a trade-off between H and Z, which is all other goods. And we also discussed the concept of the marginal efficiency of capital, which we are saying as the returns to human capital. In lesson 3, we focused on health and socioeconomic disparities. We discussed a few hypotheses, such as how education improves efficiency, how early deprivations can have lifelong health impact. We called it the thrifty phenotype. We also discussed about how the rich invest more in health. We looked at chronic stress effects on health and so on. So this lesson was basically to introduce learners to the idea that there are different models in which we can look at health outcomes. And there are different kinds of empirical studies which use these kinds of hypotheses to be able to come up with conclusions about health outcomes. And we also saw that socioeconomic status impacts health, and your health status can also in turn impact your socioeconomic status. So there is a bidirectional relationship between SES and health. Week 4, we discussed about the basics of health insurance and market failures. 3 lessons in this week. The first lesson, we discussed about supply of health. We made a distinction between suppliers and providers of healthcare. We looked at physicians who are acting as an economic agent. They may be entrepreneurs or service providers. We also discussed a particular type of a hospital, which is often not for profit. And we discussed about, if hospitals are not for profit, how do they run? The typical not for profit organization, what is the role that a patient plays in this kind of a hospital, and what is the role of doctors and specialists in this kind of a hospital? So we discussed some of the concepts like physician-induced demand, defensive medicine, racial discrimination in treatment, and so on and so forth. In lesson 2, we discussed a basic health insurance model where we saw that insurance is driven mostly by risk aversion and the concept of declining marginal utility of income. We connected these 2 concepts to justifying why people demand insurance. And we looked at an actuarially fair insurance, which means that the premiums are equal to the expected payout. We also discussed about private insurance and social insurance or social health insurance. In lesson 3, we discussed that adverse selection, the problems of adverse selection and moral hazard can lead to raising of social cost of provision of health insurance, which justifies regulation and insurance market and lead to high-risk individuals can dominate the healthcare market, as a result of which there could be a high cost fallout on the insurance premium or the insurance that is being sold in the market. We also looked at moral hazard, which means that if people are insured, then they may take less precaution of their health because they know that they're insured and their health costs can be taken care of. Or there may also be overuse of services when someone is insured, which can ultimately raise the premium in the insurance market. So both of these kinds of problems lead to raising of social costs of insurance provision, which required a lot of regulation of the insurance market, the health insurance market. In week 5, we quickly moved from health to some of the economic concepts surrounding education or demand for education and looking at education as an investment and the returns to education. In lesson 1 of this week 5, we focused on demand for education. We made a very profound statement that schooling is not equivalent to learning because many children attend school but they don't acquire skills. We looked at inequalities across incomes and countries. We pinpointed the case of Finland and Brazil. And we looked at the determinants of demand for education, such as direct costs, opportunity cost, expected returns, talent, and so on. Even here, in the context of education, we extended the human capital and human right debate. We saw that exactly as the human capital and human right debate applies to health, it also applies to education. Lesson 2 of this week, we focused on human capital investment as a model, a basic model, where we looked at the life cycle perspective, and then the costs of education, the decision rule of when to invest or how much to invest, where the marginal benefit received from education becomes equal to the marginal cost. We discussed a few key thinkers such as Theodore Schulz, Gary Becker, Jacob Mincer, and some feminist economists who have theorized around education and the role of education in human lives. In lesson 3 of this week, we looked at production and returns to education. We looked at a very basic education production function, and we saw that efficiency depends on quality of the inputs. Empirical studies have shown us that the quality of inputs, particularly with respect to teachers, have a very deep impact on the outcome of education. We also looked at private returns to education, social returns to education, and we looked at a few evidences where education was strongly linked to economic growth, health, democracy, and women's empowerment. We also looked at some of the cross-country variations, And we saw that spending on education does not necessarily always equate with quality. Efficiency also matters. Then in week 6, we learned about public goods and externalities in education. We introduced what is a budgetary policy. We looked at some of the basic functions of a budget or a budgetary policy, like allocation, distribution, stabilization functions. We got introduced to the basic concept of market failures. Then we did a classification of how do we look at public goods, private goods, merit goods. And then in the last lesson of this week, we had a general lecture on higher education. Category to put higher education in, whether it's a public good or a quasi-public good or a merit good. And we discussed many debates around this. We focused on what economist Musgrave had to say. We saw what political economist Buchanan had to say about this. And we also discussed about the commoditization of higher education, some of the dominating frameworks around this. And also we concluded with this debate on access to education versus efficiency. So this is a summary of what we have done in this course so far. And I do understand that for students who who are coming from a non-economics background or from interdisciplinary background, these are some of the topics that are covered, maybe moving very fast, but let me see if there are questions on this and we can take up. This is open for discussion now. Let me take a question from the Google Excel sheet that was shared with the learners. There is a question on the Google sheet about why we study economics of health and education. Now, there's a very simple answer to that, and I think some of these things I have covered in detail in the topic also. That you know. Health and when we talk about growth, economic growth or economic development, health and education are considered as some of the basic investments. But then that is one perspective of looking at growth and development. The other perspective is to look at them not just as investment but as human rights. And we do understand that in the overall functioning of the economy or the society, we will all agree that education and health have very important roles to play in our daily lives as well as in the economic production of goods and services. If you are of good health, your productivity increases in the labor market. Similarly, if you have had some basic levels of education or even technical levels of education, professional levels of education or vocational education, you will be considered as a skilled worker in the labor market. So this has a very so the way we are conceptualizing education and health has a very important connection to labor market. It has a very important connection to growth and development, and therefore it makes us it is important that we study the different perspectives surrounding these two important goods. In economics, we refer it to as goods. You can also refer it to as institutions. There are different perspectives to how we understand these two concepts. So that is the reason why we study about the economics of health and education. There are questions on the chat box. I can see about the question, the exam paper format, and now these are the questions. Regarding questions about how you will get to know about your center, please get in touch with the TAs or the technical staff and they will resolve these issues for you. The end date of the course, it is mentioned in the portal. If when you are going through the course, you can see what is the end date of the course. So you that also you could follow on the portal or get in touch with the technical staff. If there are any questions related to the slides or the course, please share. Where can we get in touch with the technical staff? I'm sure you have been provided an email ID to which you can send your emails to. Your emails are being checked regularly, so please post your queries on the emails and the TAs will clarify your doubts regarding exam and other technical aspects. If there are no further questions, we can end this session then. I have provided the email on the chat box. You can check. Rekha, can we end the session now? Thank you.